Now, it's emerged that the Shrewsbury and Telford Hospitals Trust has been dropped from a national government review into maternity care. It launched last month amid growing concern about the treatment of mothers and babies at hospitals across the country. The chair, Baroness Amos, says it's because West Mercia Police has raised concerns that it could have an impact on an ongoing criminal investigation into what's happened at the trust. And here's what North Shropshire's Liberal Democrat MP Helen Morgan had to say about it in The Breakfast Show.
I am quite concerned that a review into maternity care in the UK doesn't think it can learn from one of the most in-depth investigations into failings at a maternity unit over decades. I would have thought that there's something that the National Inquiry can learn from that. And I also think it's quite important that the families that were affected have their input into that inquiry, because, you know, they were the first to kind of come to light. They've been through incredible tragedy and trauma, and I think their experience is relevant to that inquiry.
Charlotte Cheshire is from Newport. Her son was left severely disabled following failure at SATH and joins me now. Good morning, Charlotte.
Good morning.
Just tell me about your son. Are you happy to talk about what happened?
Yeah, that's fine. My son Adam is now 14 years old, but at the point of his birth, he had an infection with group A strep meningitis. Unfortunately, the staff at the hospital, although they were writing down and recording many signs of the developing illness, they didn't actually put two and two together. So they didn't therefore treat him appropriately. And despite the fact that his was a full-term, healthy birth, he ended up on life support in neonatal intensive care for 23 days. For a long period of time, he wasn't expected to live. Obviously, he did, but he's been left with multiple complex disabilities that include both hearing and visual impairment, a brain injury, severe learning difficulties, autism, asthma, and he now lives, and has done for the last 3 years, in residential care due to the complexity of his disabilities and the fact that he needs 24/7 support from multiple adults at all times.
How did you find out what had happened and what went wrong and that there were failings?
In the first place, when we were initially discharged from the hospital, at that point in time, my late husband and I, ironically enough, actually felt grateful to the hospital because we only understood at the time that his life had been saved. We didn't then realize, and didn't realize for a few years later, that he didn't actually need to get sick in the first place. So yes, they did save his life, but sadly they missed all the signs of the developing illness. And it was at that point that we very hesitantly contacted a solicitor to say, was there something wrong? Should something have been done differently? Because the whole point is that at the time, the hospital never did an investigation into the situation around the events of my son. So a healthy full-term pregnancy where the child ends up on life support and in intensive care, and there was no investigation. So it was a combination of us initially asking questions of a solicitor, discovering some information, and then eventually, when the letter from then Health Secretary Jeremy Hunt via Donna Ockenden landed on my desk with an investigation has been ordered, are you willing to participate? And it was a moment of, It wasn't just us. Because up until then, bearing in mind this was about 2015, 2016, from 2011 till 2016, we genuinely thought that even if what happened to us had been wrong, that it was just a fluke. It was just one of those things, and that we were alone, or perhaps even that I was somehow to blame for what had happened. It wasn't until Ockenden was ordered that we started realising it was far more complex than this.
What kind of communication have you had from SATH? Have you had an apology or anything?
Eventually. I finally received an apology from the medical director last year, which, to be fair, was a very good apology. But bearing in mind my son was born in 2011, and that solicitors on behalf of the hospital trust promised to give me an apology when I was in the High Court in 2021, that apology finally materialised via the medical director just last year.
What do you make of this announcement, Charlotte?
I think it's absolutely extraordinary. I cannot comprehend that up until this point, the inquiry into Shrewsbury and Telford maternity failings is the largest in NHS history. We do know that Nottingham is set to be bigger, but it hasn't published yet. So as of right now, ours is the biggest. And for the Amos review to consider that there is perhaps nothing that they need to learn from our situation is extraordinary. And that it's not just that they're not taking the initiative to contact us, but even when many of us, myself included, are taking the initiative to contact them, we're being ignored. And there is a long-term saying in the disability community that I think is really relevant. Nothing about us without us. And this is the story of families in Shrewsbury and Telford who have suffered irreparable harm. And how on earth any review into maternity services can now be decided as not involving us is beyond belief to me.
This has been so consuming for you, for your life and everything that's gone on. I mean, you haven't been able to live your life normally because of this, have you?
It's changed my life forever, without a shadow of a doubt. I mean, the birth of a child obviously should be a happy moment. And of course, I love my son unconditionally, just as he is. But the level of trauma that has also accompanied his birth and the last 14 years of his life so far is incalculable. And my husband, unfortunately, died of cancer in 2020, but he had nightmares until the point that he died of the moment where he witnessed a crash team surrounding our newborn son as his whole body was blue and convulsing. And he had nightmares about that until the day he died. I mean, that's an indication of the level of trauma that is just in our family. And of course, that's replicated in different ways in families across Shropshire.
Have you joined up with other families? Have you got together and formed a group to discuss this in detail?
Yeah, so we are still intermittently meeting with Donna Ockenden, unfortunately, because for a long period of time, SATH wasn't actually talking to the families. They were attempting to work on improvements, but they weren't talking to us. Finally, a year ago, Donna Ockenden came back to this area and has started meeting with groups of families to be able to liaise for us to meet one another. But there's also a very small number of families who have maintained contact on social media.
The police, West Mercia Police, have raised concerns that it might interfere with an investigation. What's your thoughts on that then? Do they have a point?
I find it very difficult to understand because there are many situations in the past where police investigations have run alongside inquiries. And I understand the police have an important job to do, but their process inevitably is going to take a very long time. As far as I know, it started in about 2020. It's still going on. And even if by chance the police may have legitimate reasons for that, I still maintain the fact that nobody has talked to the families at the heart of this, who are the most affected, is severely problematic. Nothing about us without us. And it just demonstrates that this is not a trauma-informed process, and it needs to be, because all of us carry trauma.
What would your message be to the government and Baroness Amos?
Talk to us. Literally, as simple as that. Talk to us. Meet with us. At the very least, explain your decisions, but be prepared to meet with us, because many of us have asked them to do so, and we're just being ignored.
Charlotte, thank you very much for sharing your story and for talking to me this morning.
You're welcome.
That's Charlotte Cheshire. And we have approached West Mercia Police for a comment. We are waiting to hear back from them. But of course, as soon as we hear, we will let you know.